cleared to go.
Okay, excellent. All right, good evening, everybody. I'd like to welcome you tonight. This is our third public forum. My name is Anthony Insaldi. I'm the town administrator for the town of Wenham, and I will be moderating tonight's forum. I'd also like to thank our co-sponsor for this evening, and that's the town of Hamilton, in particular their town manager, Joe Domalowitz, who is on the line. He's called in, who I've had the great pleasure of working with throughout this year and throughout this pandemic. So tonight's process for the forum will go as following. I'm going to introduce our panelists, and then I'm going to circle back to each entity and ask and give them about 5 minutes to do an introduction statement, and they can share that time, or one person can use it. Then we'll go to questions. And if you would like to ask a question, we're going to ask that you go, excuse me, to the chat function and type your question into the chat box, and then I'll recognize questions. We did have some pre-submitted questions, so I'm going to try to alternate between what was submitted and what is submitted tonight live. All right, so for tonight's panelists, joining me from the town of Wenham is our Board of Health Chair, Dr. Andrew Ting. I'd like to also recognize the other Board of Health members, Regina Baker and Jerry Donnellan. Our public health nurse, Mary Beth Ting. From the town of Hamilton, the Board of Health Chair, David Smith. Also would like to recognize the two other Board of Health members, Dr. Giselle Perez and Christopher Small, as well as their public health nurse, Christine Lee. From the Hamilton Wenham Regional School District, we have Superintendent of Schools, Mary Beth Banos, and Tom Geary, who is the Director of Facilities. We also have with us the School Committee Chair, Michelle Bailey. From Gordon College, we have the Vice President for Marketing and External Relations, Rick Sweeney. We also have with him Chris. I'm forgetting your last name, Chris. I'm sorry.
Jones.
Chris Jones, Associate Vice President for HR and the Emergency Management Coordinator for the college. And from Gordon Conwell Theological Seminary, we have the Dean of Students and Title IX Coordinator, Jana Holliday. So with that, I'm going to start in that reverse order and ask Dean Holliday if she'd like to start with a statement and give us a little update on what's going on at Gordon Conwell.
Absolutely. Thank you so much. I'm very happy to be here tonight. I'll be very brief. So in addition to being Dean of Students, I serve as the chair of our Pandemic Planning Committee, which, believe it or not, has been in existence for at least a decade, but I don't think has met as intensely as we have in the last 6 months. So we've been working hard. We went fully online this past spring, and then since over the summer, we've been working on a reopen plan, and we are planning on reopening. Classes begin a week from today. We're going to do just a variety of different modes for education. Some will be in person, some classes will be online, and some will be what we call digital live, so students have an option. So we feel like this will provide us with a lot of opportunities to create safety. We have plans for when we've kind of prepped everybody for if certain things happen, when the triggers happen, we're going to be moving online. Everybody's ready for that. We have a graduate level community, so we have a lot of people who are kind of older, more mature. They've been doing just a really wonderful job following the regulations of wearing masks, physical distancing. So yeah, we're feeling right now pretty well. We have 0 cases on campus right now, for which we are very grateful. But I'm happy to answer any questions you have. But yeah, we'll see how this goes.
Thank you, Dean. Next, I'm going to go to Gordon College and Rick Sweeney.
Thank you, Anthony, and hi, everyone. I'm very happy to have the opportunity to join you in this forum, and certainly looking forward to being a resource for everyone in the town as it relates to questions about Gordon. Worked very closely with Chris Jones and a number of my colleagues on the leadership team in terms of how we've been managing the reopening of the college and how we manage the health and safety of the campus, which is really on a day-to-day basis. And at least in terms of kind of background, what I wanted to do is to give you a very quick overview of what we've been doing at Gordon and how things have been going. There's really three things I'd like to make sure that everyone is able to kind of take away as both the status update and an understanding of what we've been doing at the college. So we started the fall semester probably a couple of weeks ago in terms of trying to get classes going. As most of you know, we're contained and primarily residential around the corner of town. It's what students have often lamented in the past as being stuck in a Gordon bubble, feeling like, they're over here on campus and, if they don't have a car, there's nowhere to go. Well, in a pandemic, that's actually a huge advantage for us. And so we've been embracing the idea of the Gordon bubble. And as we went into this semester and as we brought students back to campus, we've made very clear that our intention is that they will be staying on campus and that we will be closely managing the activities and the ways that they interact and live with each other in this semester. We're very much motivated for this to be a successful semester for them, but everyone understands that you can't eliminate the virus. So you've got to be able to mitigate the effects and you've got to be able to manage the process from day to day. And we've been doing that very aggressively. And we've been very happy with the results so far, which I'll touch on in a minute. So within that, there's a couple of things to understand. You should be able to see a resource for us. It's on our main website. The page or the section itself is gordon.edu/reopen. And that's a web resource that we created over the summer and that we've been updating on an ongoing basis. It was principally used initially with students and parents and faculty and staff so that everyone can understand how we were preparing to start the semester. And we've been using it since then as a publicly available resource to drill down a little deeper, to really understand how we've been trying to make the process work. So I encourage you to check that out if you really want to try to get into some of the details. I think you'll find it very helpful. So embracing the Gordon bubble is probably strategy number one. And the second thing is we've gone beyond what the state and the CDC require in terms of standard protocols regarding mask wearing and social distancing and so forth. And we've been pretty stringent with the students in terms of how we need to enforce that, including having everyone sign a statement of shared responsibility where they could at least evidence in writing that they will work together with us to make sure that we can keep the campus safe, because if we keep the campus safe, by extension, we're keeping the community safe as part of the community, even if we're kind of sequestered on our own little corner. I've been very pleased with the response. Gordon students are often, kind of derided a little bit for maybe being, more likely to follow rules, not quite as, wild and crazy as the stereotypical college student. Well, again, that's an advantage. And we have students who are often motivated by a sense of personal responsibility. And that's been really helpful. They've been really stepping up to the plate. So with that, the thing I wanted to make sure I shared in terms of how we got the semester going, we, in order to get out of the gate, employed what we call the dual testing strategy. So as students were ready to return to campus, and certainly before anyone could start a class, they needed to have hard copy proof of a negative COVID test that met the Massachusetts standard, which meant that had to have been taken within 72 hours of arriving to campus, and they were not allowed to come onto campus or move in to a residence hall until they met that requirement. That went very well. We managed those that weren't able to come on immediately and brought them in when they were essentially deemed safe. And we followed that with the second part of the dual test strategy, which is a full testing of all students that was conducted early last week. And that allowed us to set a baseline for managing the day-to-day health and kind of the status on campus, which is what we've been doing since then. And I should know, because this is very important, it's been a real important aspect of what we've been doing to work very closely with the Wenham Board of Health. We very much appreciated the Tings and the close relationship that they have in a personal way with a number of the key players on the ground for us, including Chris Jones, as well as the Gordon College Health Center, and with Anthony and Saldi, providing the kind of the administrative leadership for the town. Even before we get to the process of coming back to campus, we were in regular contact and looking for all ways that we could cooperate with the town to try to manage through through this extraordinary time. And so we're really, really grateful for that. And so as we've gotten into the process with the testing, I mean, the third point that I'd ask you to take away from this is that we've been very encouraged with the results. So as of yesterday, we've conducted through the Broad Institute, we're one of 100 plus schools in Massachusetts using that organization to provide the testing. It's very accurate, and we get results within 24 to 36 hours. And at this point, we've completed a total of almost 1,800 tests. And of those, we've only had 6 test positive. So that's a positivity rate of basically 0.33%, which is well below the 1% threshold that the state has set. So we were very, very encouraged by that. And that puts us in a good place to manage the ongoing kind of tracking of campus health as we move forward in the semester. So I'll leave it there.
Thanks, Rick. And I do appreciate the partnership that Gordon has had with the town and with our Board of Health. I appreciate that very much. So thank you. From the Wenham Board of Health, Dr. Ting or Mary Beth?
So I'll just start off. So my name is Andrew Ting. I'm the current chair of the Wenham Board of Health, and thanks for everyone joining this public forum. Obviously, there will be a lot of questions. Hopefully, we can answer them to the best of our abilities. And again, just to my preface is that, again, this pandemic is very fluid. The fluidity of which we see things happening both from a local level, regional, statewide, and national change pretty often from day to day to week. Where we were in April of this year is much different where we are now. But again, it's probably due to all the hard work that everyone's been doing with the those mitigation strategies of face covering, social distancing, frequent hand washing, disinfecting, and trying to really be safer at home has really brought at least the state of Massachusetts comparative to all the other states in the United States in a really good place. So again, we looked at all those things as we, both boards, David Smith and Hamilton and myself and Wenham, looked to try to keep our citizens as healthy as possible and hopefully can retain some aspects of normalcy as we go forward. So Mary Beth Ting will probably have a little bit better description of what's going on in the town of Wenham.
Thank you very much. I want to thank all of the people who have tuned in to participate this evening. This is our 3rd public health forum, and I'm thrilled to see a good number of people here. We're just about to crest 200, so that's fantastic. I'm glad for everyone's interest. I don't want to belabor too much about the town of Wenham. We did update the numbers on the town website today, and I know that there are a lot of questions and other panelists to begin speaking. So I'm going to pass my time along to the rest of the panelists and speak more when questions come up. Thank you all for tuning in.
Thank you, Dr. Ting. Thank you, Mary Beth. Because I have a funny feeling that most of the 199 people here want to really hear about the schools, I'm going to save you for last. And I'm going to go to the town of Hamilton and their chair, David Smith.
Thank you, Anthony. I want to address specifically the charge that Superintendent Banyos gave us, the Hamilton and the Wenham Boards of Health, to develop this metrics document. We prepared this collaboratively between the 2 boards to respond to her request for guidance on reopening and operation of the schools. And I think all of us struggled with the fact that we're really dealing with an unprecedented time when we have limited experience and historical data on which to base an approach to this metrics document. A lot of the decisions that we made are formulated on the basis of what we know about disease transmission and mitigation, and recognize it's constantly changing. Really what we try to do in our metrics document recommendations to achieve a balance between protecting the public health and safety of all the students and staff while providing for the educational needs of all children. So those are the principles on which we developed the metrics document. Is it perfect? No. Is it never going to change? No. So I want everybody to try to recognize that we did the best we could with what we had and try to strike that balance that I described. So thank you, Anthony.
Anything else from Hamilton, Dave? Any numbers that you want to share along or pass along?
I'll leave that up to either Dr. Perez or Christine Lee. Any comments?
Dr. Perez is shaking her head no, but Christine, would you like to?
I'm saving my comments for all the questions.
Thank you.
Thank you.
And from the, 1 second, I just need to mute. From the schools, I'll turn it over to Superintendent Banyos, and then you can share your time with whoever you need to.
Thank you so much to the town of Wenham for hosting this important public forum. I would like to publicly recognize the efforts of the boards of health. We did reach out to them for their assistance. One of the major questions we had in our plan development was how will we know when we may need to shift our modes of learning dependent on what's happening with the COVID virus. And both boards of health in Hamilton and Wenham stepped up to that charge and that request. They were diligent, they were thoughtful and amazing partners. And I, again, would like to thank them publicly for that. As many people I would assume this evening that are on the call know, there was an uptick in terms of COVID infection rates that have pushed us into an area that is suggesting and informing us to move to a remote learning environment until those numbers stabilize. I'm sure there's lots of questions about that. Again, I am incredibly grateful for the boards of health for their help and for being here this evening to help explain to our community why the metrics are the way that they are. And I look forward to being a resource and answering any questions. I'd also like to be sure that Tom Geary, who is heading up our COVID team, has an opportunity to introduce himself, and our chair, Michelle Bailey, is also present. So Tom, do you want to jump in?
I'm sorry.
Yeah.
Is the other Tom Geary on? I want to make sure that you're not asking me who
Yeah.
you led in by.
I'm here.
Yes, thank you.
I put the Hamilton Wenham seal behind me just so there's no confusion. So thank you, Tom Geary. I'm the Director of Maintenance, Facilities, and Operations for the district. I'm also honored to serve as the project manager for the COVID team that looks at the metrics with our public health nurses and our administrative team, and also our union members. So my pleasure to serve. I will yield my time to Chair Bailey. I will save my voice for answering some of the technical questions that people may have regarding the schools.
I would just state that we have been working quite diligently to reopen the schools. We've been working to welcome our students and our staff back to our buildings as soon as possible. Today's events are a little bit of a disheartening event, but we're still on track. We're looking to have our students back in the buildings by early October, as long as we can keep our numbers from increasing over the next week to 2 weeks. So, and we're happy to answer questions. Also on this call are several of our other school committee members, including Stacy Metternich, Dana Alara, who serves on the COVID response team, and Peter Walczyk.
Thanks, Michelle. So just as a reminder, we're tracking questions on the chat. So if we could just keep the chat function to questions, it'll make it easier for me to go through them and try to make sure that everybody's question gets addressed. So I'm going to start at the top. First question from John Mulville is, if the death rate for people under the age of 20 was 0% in Massachusetts, and that's 2 weeks ago, in parentheses, why do we think our students are at such a high risk? There's been 0 deaths. So I don't know if Dr. Ting or maybe David has any data. I'm not aware of the statistics for folks under the age, children under the age of 20.
That's the governor's data on his website.
Thank you.
So if you look at the latest Massachusetts EPH dashboard, you'll see that in the category from 0 to 19, the mortality rate has been 0, and essentially it's been like that from pretty much the beginning. Although then from 19 to the early 20s, there've been some deaths. Again, you have to remember this is only the numbers that are posted in the dashboard for the last 2 weeks. If you go back to, let's say, June 10th, you'll see that there were actually 95 hospitalizations for kids between the ages of 0 and 19. So yes, the mortality rate is very low to 0, but the morbidity or the hospitalization rate is not. And I don't know, for me, mortality and then hospitalization, I never want to have a mortality. I will tell you that. So I'm glad that the number is from 0 to 19, 0. I do not want to have a mortality in that category. But I can't tell you if you get sick at that age group, potentially could be a mortality statistics. And that's, of course, we want to avoid. And so a lot of our decisions we made on the board in the public meetings we had and with the school committee was to try to be as conservative as possible, knowing that we just don't want to be one of the statistics that we put on the dashboard. So you are right that in that age group, but I think there are other circumstances and other factors we need to look at for keeping our children safe, just more than just mortality rate. David?
Can I add one thing to that also? Our schools house not just only our roughly 17,000 students, but they also include our 300 staff who are adults. So we are having to look out for our entire community of people who use the schools. So when we're looking at what is safe, we are considering all the people who are in the schools.
Right. Michelle, let me pick up on that point. It's one thing to look at purely the mortality rate, which is correct. It currently is 0 in the age group 0 to 19. However, we know that children can carry the virus and transmit it. And the concern is this: a child may become infected, but be asymptomatic, infected at home, be asymptomatic, come to school, and communicate that disease to a teacher or staff person. And that won't show up in the mortality statistics for the children, but then that infected teacher may go home and transmit it to, let's say, their parents, and that may end up being a statistic. So we've got to look at the whole picture and not just that pure mortality number.
Just to add one more to that, because an important piece on this issue of asymptomatic, what a recent study actually from the Mass Journal that had come out determined that I think it was close to 50% of children who were partaking in this study had non-specific symptoms. So not the typical symptoms that one tends to think of when it comes to COVID-19. So that's another factor to keep in mind, especially as we're sort of entering flu season, that there might be symptoms that could potentially lead to the spread that would not necessarily be considered something that would be an indicator of COVID-19.
Thank you, panelists. Next question, I'm going to throw it to Gordon and Gordon Conwell. And I believe, Rick, you had already answer this question from Laurie Bouchard. It says, is Gordon College in the seminary testing? I think, Rick, you went through your testing protocols that you have in place. I don't know if you want to expand on that, and then maybe Dean Holliday can continue after.
Yeah, and I'm happy to do that, and I can offer to Chris Jones to jump in if we need anything more specific. But yeah, again, we went into the start of the semester with the goal of having a full baseline test of all students, and that allowed us then to manage from a day-to-day and week-to-week basis the health status of students as we've gone into the semester. So we have the ability to do what I think the technical term is called surveillance testing, but basically that's testing when there's any indication that we need to be confirming a status with a particular student. And there are a number of protocols for that I know we outline in detail on the website. Chris, I don't know if you want to add anything to that before we turn it back over to Gordon Conwell.
Yeah, just ongoing, we're doing somewhere around 300 to 350 tests a week beyond the mass tests that we had last week, where we tested every single student. So we are doing continual testing throughout the semester, and being very aggressive in if we do get a positive case, isolating that. We have residence halls designated specifically for that, quarantining the close contacts, and then even holding the floor of anyone who might even be close but not such a close contact until we confirm that they are negative.
Yeah, so we talked to the Board of Health for Hamilton, who recommended that, or they said that we should strongly recommend that our students get tested. So that's what we've consistently communicated. We've also followed all of the Massachusetts guidelines for testing. So people who are moving here or have traveled are required to submit their COVID test to the school nurse who's been collecting that. And we have similar protocol. We have spaces set aside for quarantining for our dorm students, and then obviously apartments are kind of self-sufficient there.
Thank you. Staying with both entities, the next question is, I was informed that a resident at Gordon was not using protocol in the housing common areas, and they said they personally know a student that left the seminary being high risk. Dean Holliday would.
Sure. I mean, I don't know the specifics of the situation, but we very, very regularly tell our residents to wear masks, keep social distance. You probably can't go 10 feet without seeing a sign that tells you something along those lines. So if we are aware of such a situation, we're happy to deal with it, but we've been messaging a lot.
Thank you. Rick or Chris?
Hi, I just wanted to say, frequently I get calls from neighbors or even family members if they feel someone is out of isolation or out of quarantine. And I believe Jana was away at that time. So I was in touch with, I'm sorry, your second, Mia Ertel. And she and I discussed that the person, in fact, had already been off their isolation. Isolation is a 10-day period for someone who's anxious or, really feeling that there's someone that's going to infect them close by. They're not aware of the time frame, that 10-day period that we're working with. So I'm receiving, as Mary Beth in Wenham, Mary Beth Ting, is often receiving calls. People are I don't want to say, neighbors are in touch with us to inform us in case we have missed discussing something with a positive case. So in the case with Jana and the seminary, it was a miscommunication and someone was on high alert. There was no out of quarantine or isolation. Thank you.
Thanks, Chris. Okay, I'm going to go to a pre-submitted question. This is probably directed to both boards of health. Please explain why you felt it's necessary to adjust our metrics to 6 cases per 1,000 versus the state number of 8 cases per 1,000. It certainly cannot be due to our population density, number of apartment buildings, or multi-generational homes. And there's a similar question that says if we use the state standards, we wouldn't be doing remote learning.
Okay, Anthony, I'll start. I don't necessarily want to finish on what I say, but when we approached this assignment from the superintendent, we had a couple of public meetings, and there was a very strong, I thought, sense amongst the community that they wanted us to be conservative and not freewheeling with our numbers. That is, rather than just take the state numbers at face value and not question them, not evaluate them on our own, we felt we should adopt a little more conservative an approach to selecting these green, yellow, and red categories for school, the school modalities. Yes, they are a little more stringent than the state numbers, and the reason was, again, I think there was a strong consensus in the community that that's what the community expected. The community certainly, I think, would have been uncomfortable had we selected numbers that were higher than what was suggested by the state. But, and you can always question the DPH numbers themselves. The Department of Elementary and Secondary Education numbers that they promulgated. I think right now, all of these numerical values are judgments. They're judgment calls. So, Andrew, Mary Beth, anybody else want to comment?
I have a quick question. Is the host of the meeting able to cut callers? There was just a comment that spoke of freewheeling with numbers. Are we able to drop callers that are just tossing comments just to dig?
You know, I'm certainly going to try to get the questions that are meaningful and can be helpful to our residents, both in the towns of Hamilton and Wenham, Chris. So we'll do our best. And if somebody does put a comment out there that is inappropriate, we do have 2 other monitors monitoring this forum, and we will remove them.
Thank you.
Dr. Ting or Mary Beth, did you want to continue on with David's or?
I guess I mean, again, through the different committee meetings that we've had, either the joint board committee meetings or with the school committee, it did become apparent that the individuals who were present wanted to be more on the conservative side than liberal side in terms of the sort of cutoff value. And again, the cutoff value, no matter how you put a cutoff value, some people like it, some people won't like it. It will increase risk or decrease risk. So the number 6 was, yes, less than 8 that DESE had put out, but compared to what other communities had used, it was pretty much in line. Some communities that have very high levels to begin with had to push their numbers artificially just so they could try to have some sort of hybrid, but in the end, they ended up going to remote anyway. So, so I think there was a question of what, the 7-day versus 14-day. So the state publishes 14-day data. So they're looking at the trend of the number of cases in a 14-day period. The 7-day was an alternative metric to follow because the school, we heard from different people that we needed to be more nimble at determining whether or not there was an increased risk. And 14-day data, obviously because it's based on 14 days, was a little bit slower. So one thought was to do daily data, but the variability of having daily incidence count is just erratic, right? You can't make a decision because one day you're in, one day you're out, one day in. So there was a compromise made to use a 7-day data, which you can calculate by taking the number of cases reported each week by the state, as well as both towns of Hamilton and Wenham. We use a epidemiologic system called Maven, which provides us data on a weekly basis, so we can get actual weekly numbers. And so that's how you got that the weekly rate. The every 7-day rate per 100,000. Again, the per 100,000 is just a way to normalize data across, so you compare apples to apples. Again, Hamilton, Wenham are very small. The total population is 13,329 roughly, as opposed to, let's say, Peabody or Danvers, which has 50, 60,000 people. So again, we had picked a number, and that was what was floated and recommended to the school committee and the superintendent, and we felt it was a good number to choose from. Did we think we were going to have a number like this? No. That we were going to go above 6? I don't think any of us thought that would occur, but obviously, data changes and the fluidity of the pandemic, it is what it is. So, it is what we could figure out after several meetings.
And can I just add something to that? Is that what DESE put out for regional districts like ours is, just use the town that has the most students coming from it. So no matter what Wenham's numbers were, they would say just use Hamilton's. So we needed to ask the boards of health to provide us with other guidance because we felt like that was an unsatisfactory answer. And we also are a unique district in that we actually have a positive choice in student rate. So we have students traveling from many districts to our district. So we wanted to be sure that we captured a lot of that information. So we really could not rely on what the DESE said because it could have allowed there to be 500 people in Wenham that were sick, and if Hamilton was fine, we would still be going to school, which would have been totally unsatisfactory data to use.
Yeah. Michelle, I want to pick up on that point. You're absolutely right. DESE came out with a very simplistic rule to the effect that multi-town districts simply use the town with the highest population, the highest number of students in the school, period. That was it. We felt that was unreasonable given that a very similar number of students from both Hamilton and Wenham attend the schools. And so it just made sense to combine them. But beyond that, many people commented, but what are you going to do about the fact that a lot of students, a significant portion of students in the school district come from other towns? And what about the teachers and the staff who live in other towns? So you can't just isolate on Hamilton and Wenham in a bubble. The staff, the students and the staff and the teachers come into Hamilton and Wenham from a lot of other towns. So we tried to account for that by taking first the Hamilton and Wenham statistics and weighting them as the most important, and then also taking the data from an entire ring of towns around Hamilton and Wenham. I think it numbers 12 right now, to account for students coming in from those 12 towns, teachers and staff coming in. So we try to recognize the realities. We are integrated across a lot of towns. We don't live in a little isolated bubble here. So the metrics that we presented account for that fact. And your comment is absolutely correct. The state didn't dictate that this was the only way you could go. They certainly gave us the freedom to make an intelligent choice about how to develop these metrics. And that's what we did.
Mary Beth, did you want to add to that? I saw your hand was up.
I did. I was just going to add something that Mr. Smith had just spoken to, which was when the Department of Elementary and Secondary Ed released the initial guidance that was in line with the map, the color-coded map from DPH. And then they said we will release guidance relative to regional school districts later. And then they made the statement that they did. But in other calls from the Department of Public Health to local boards of health, the representatives from the Department of Elementary and Secondary Ed have made it very clear that it's a starting point and they've really encouraged local boards of health to work with their school departments to make decisions that are appropriate for that municipality. That's the only thing I wanted to add.
Yeah, and did they indicate when more guidance would be coming out for regional schools?
I think we've got what they're going to give. I don't know that they're planning anything more.
Right, like their guidance for Essex Tech is go with whatever Peabody is. Great, you know, if Gloucester is red hot, just go with what Peabody is. So,
Yeah.
Hi guys, just wondering if the local population can talk here, or is it just
Mike, we're asking residents to put questions into the chat function, and there's a number of questions that have been submitted. So I'm going to go down the list. So if you'd like to ask a question, please type it into the chat box.
Yeah, I have just wondering, can we talk as well or no?
No, thank you.
Okay, so censorship.
So I'm going to go back to Gordon College. Rick, oh, actually, no, this probably would stay with the Board of Health. Is there an instance where Gordon College numbers would be redacted from our metrics? How about we start with that?
Yeah, so I can address that. So that was a discussion of, you know, we have both Hamilton and Wenham have colleges and or graduate schools within their proper districts. And as much as each one is trying to remain as a sort of isolated or insulated community, obviously people are free to travel, and it was thought that we still needed to contain the numbers that occur at both institutions within our own numbers, because currently that's how they're reported, right? They're reported to the state as these tests occurred in this town. For us to then to start pulling out data of certain groups and individuals, we felt was just not proper to do with the data that was provided, because then we could start doing that for other smaller components of the town and say, well, do we pull like the folks who become positive in the in elderly living areas, since they don't travel around as much, or certain areas here, and we felt like that was not the way that the data wants to be presented. And again, yes, because our town is so small, a small number of individuals with a positive test does push our positivity rate up. And that's the unfortunate component of the fact that we are in small towns. Though combined, we were hoping that it would at least to some extent level it out. If one town remained low and the other one went up a bit, that would normalize out. Unfortunately, we had a number that was it's just one person, right? So given the way that the statistics is, you know, one person gives you another like 2% or 1.889%, it comes out to be something like that. So, you know, that's how we were gonna look at the data, that we just could not remove Gordon College from, at least from the Wenham data.
And is that documented, the metrics documented on the town's websites, or is it on the school district's website that residents and parents can take a look at?
I can share that at last night's faculty meeting, we linked to the metrics document. So if people go onto the website and look at the agenda for last evening's school committee, they can find that. We made a note today of this forum in our news. I'd be happy to post those metrics directly. And communications that will be going up will also include that, so people can reference them.
Anthony, the answer is also that those two documents are accessible and via a link on the Town of Wenham website under, I think it's the Board of Health page. You can actually see the links to them on the website and download the documents right there.
Great. Thank you, Dave and Dr. Ting and Mary Beth. I am going to go back to Gordon College now to keep Rick and Chris active in this. Rick, if students tested negative before coming on campus and live in a bubble, and behave safer than most college students. Does Gordon have a sense of how those 6 kids tested positive? Yep.
Chris may be able to speak to that in a broad sense. My comment would be, I mean, this is part of the reality of this particular coronavirus. If you're talking about the ability to actually test positive and be completely asymptomatic, it's very difficult to tell where or how somebody may actually contract the virus in order to show up positive in a test. We're looking more at what the overall result represents for the number of individuals that are actually tested. But Chris, I don't know if you want to speak into anything in terms of how someone would have tested positive. I mean, of course, coming to campus for the first time, they're coming back to the area, and it's impossible for us to know why they may show up as a positive or negative, which is why we required that they actually had to have proof of negative tests before we would let them come onto campus.
Yeah, and just quickly, the test is a point in time test, and so when they did have a negative test prior to coming, but then I mean there was one example where the day after the student moved in, one of the parents did get sick and tested positive. Obviously, as soon as we were notified of that, we quarantined the student and then tested them, and they were positive as well, but they were negative just a couple days before. So you can be infected yesterday, you can be in touch with someone and get infected yesterday, you could be tested today and you'll test probably negative. It's a high false negative rate right at the beginning, and then after some days go by, then after some time you if you do get infected, you'll test positive. So there is that delay, and that's where no testing strategy is perfect, but working hard to, when you are aware of it, taking quick action. We're working with the Wenham boards of health, and take quick action to quickly isolate, quarantine, contact trace, and so that when this does happen, even at the low percentage we've seen it, the idea is to take very quick action so that it doesn't spread any further.
And Mary Beth, I saw that you had a question, and I don't know if Chris answered it too, but I guess what might be helpful for some of the residents too is, once a student becomes a part of our community, correct me if I'm wrong, they would now be traced, contract traced, and be in our be part of our data through the Maven system. Is that correct?
That is correct. So the way, I don't want to get too granular with this information, but whenever someone is tested, you go to the lab, you have the test. The lab slip that's going with that test has your home address on it. And for the Gordon students, when they did their mass testing, all of them had the Gordon College address. So that's Wenham, Massachusetts. So when the positive tests flow in, that comes into my workflow in our electronic system. And so I have been in contact with these students to check in with them, how they're feeling, track their progress through the isolation and the quarantine period, ensuring that we identify who all their close contacts are, and ensuring that they're getting what they need, because they're kids away from home and wanting to be sure that they're getting food and fluids. And I have to say, there have been some minor hiccups, and Gordon College has been extremely responsive. I communicate by text and phone call more with Chris Jones than ever before in my life. And I have found him and the staff at Gordon College to be extremely responsive. So if I were a parent sending my child off to college, I would certainly want to be sure that if in the middle of a pandemic, they're going to be well cared for. And that's what I've been finding. They've been very good to work with.
Yeah, I echo those comments, Mary Beth and Rick. In the past, I think that there's been some students that have been hired by parents and some residents in the community of Wenham, and maybe even Hamilton too. I'm not sure about Hamilton, but to help in their homes. Is that happening now? And is that something that they're not allowed to do, being inside the Gordon bubble?
Yeah, that's a good question, Anthony. My understanding would be it's not. I mean, basically, we're not operating normally in an abnormal situation. So, we've at the start of the semester had tried to limit many things that would have been normal, mainly because we didn't want to introduce added risk. So, for example, even field trips that faculty would normally take, even if it's something where they could take a small group of students and kind of manage a trip somewhere off campus, we've basically ruled those out for this semester and the foreseeable future until we reach a point where we're actually closer back to something that's considered normal. And a lot of the communications with the students have been trying to emphasize again that we don't want to be adding additional X factor risks by them being too active or going off campus, or in some way not sticking to the very strict social distancing and mask protocols that we have in place. Chris, I don't know if you wanted to add to that at all.
Yeah, I mean, the only thing I would say is, the statement that all the students signed was, asking them that to really reduce the time off campus, to try to get jobs on campus, to reduce what they're wanting to go do. Are we, chaining them to their rooms and not allowing them to go off campus? No, we ask them to do that. If there's a resident of Hamilton or Wenham that chooses to hire somebody and they choose to go, again, just like you can do unsafe things and not follow the guidance, and it is a decent sized campus. So we have asked them, we have trained them about what we need to do to both keep the community safe, the broader community, and our campus, and we continue to reiterate that as much as we can.
Thank you. All right, I am gonna pivot towards our schools for a second. And what about testing the kids, the teachers, the staff? Why is that not required? If it's needed, how would it be arranged? Where are all the local testing sites? Is there sufficient testing capacity for our needs? And if a student tests positive, what happens with the students, the teachers, and the kids in classes?
I could start with a couple of broad comments around that, and then I would ask Mary Beth Ting to jump in and provide some additional data around local testing. So one of the things that is true here, and I believe almost all public schools in Massachusetts, is the capacity to test is not there. What the DESE has arranged is that if a school has a cluster of cases, they have put together a mobile van that will come out to the school and then test that particular community if there was evidence of a cluster in that school. So that is the help that we're getting from the Department of Education at this time. And then Mary Beth, could you speak to the capacity at the local level to test all students?
My understanding is there's not really a capacity issue in terms of testing right now, but it is not recommended necessarily for mass testing at the K through 12 level. I'm going to tip it to Dr. Ting in just a second to talk about the presumptive positive value of testing, mass testing. The difference between the K through 12 schools and Gordon College and the seminary is congregate living. We do not have students living in residence halls or dorms. They're living in individual homes. And so that reduces our risk.
So Mary Beth was hinting to what we call the positive predictive value. So taking any sample where you provide a test based on its sensitivity, the ability to determine that that a person who has disease really has disease, as well as a person who doesn't have disease, gets less accurate as the percent of the disease entities in the community. So if you took 100 kids in our percent positivity rate, let's say in our town is very low, the likelihood of these tests having either a false negative or a false positive is increased, as opposed to early on during the pandemic when we were only testing individuals who had symptoms that were very consistent with COVID. When we tested them, lo and behold, they were positive for COVID, because my positive predictive value for that person having COVID was very high, and therefore the test reconfirmed that was the case. As we start to do more asymptomatic testing, you see that the number of tests performed in the state of Massachusetts is rising and rising, because the thought is we just want to test everyone. you are going to get into that scenario where you're going to falsely call someone a negative who potentially is positive and vice versa. And so there's been a lot of discussion for various school settings to either do testing, mass testing, or to do testing based on symptomology. And there's not necessarily right or wrong with each one. It's just that whatever one does, they definitely have to do it potentially in multiple ways, or at least longitudinally. So you're just not doing a one-time testing, but you do it on some kind of a basis. So that's why I think that, at least for the school district, for all of our kids and teachers, it's probably not a, for us, recommended given our situation in terms of our living situations, as Mary Beth was saying.
Okay, thank you. I'm going to go to Tom Gary, Director of Facilities, and not the parent, Tom Gary. Tom, I don't know if this would be your question. The question is, though, can you speak to the plans and policies for meals and cafeteria uses?
So as far as for remote or?
That's all the question was. So I guess that this was probably before the decision today to go completely remote. So if the kids were in school, how would that work out?
Sure. So, under the best circumstances and weather, encouragement to eat outdoors was the preferred method. Elementary school was planning on eating within their classroom. Middle school and high school, if there was bad weather, we have socially distanced 6 feet apart, at least 6 feet for individual seating in the cafeteria with the small groups. So that's how the operations for lunch would be handled. Pre-packaged meals, pre-ordered in the morning, so they're delivered to the classrooms or to the specific assigned seat for the students that use the indoor dining services.
Thank you. Superintendent, with the new revelation today about going completely remote, how does that affect the fall sports? I saw a tweet today that I don't know if that was before or after the 3 o'clock announcement.
So that is an open question at this point. I can tell you that at the state level, if a district using state metrics is in the red, they are not able to participate in sports. We in Hamilton Wenham have held a more rigorous standard around that. We are now, during that period where we're in remote, we will need to reach out to our committee again for conversations regarding whether or not that would be appropriate under these circumstances. And given the timing of this particular issue, that is not a question that we've been able to process at this point. Currently, sports are scheduled to start on September 18th if all the local communities decide to join in. But again, this is a question that when the school committee met last evening, this scenario was not on the table and will need to be revisited. Michelle, do you want to add anything to that?
I had a discussion with another member today when we were trying to figure that out. So I think we're going to need to go back and watch the tape to be clear as to what we voted. But I concur with Mary Beth that the fall sports must be canceled if by the DESE's map, Hamilton is in the red and we must be remote. But where this is our own metric, we're not in the must, it's could. And I'm not, there's a quorum of the membership here, so I'm not going to give my own opinion, but we're going to make the choice that's really going to be best for the students' mental and physical and emotional health.
All right, thank you. And staying with Mary Beth, what do you consider your biggest challenge for the upcoming school year, and how do masks intersect with dress code requirements?
So, there's no lack of interesting challenges at this time, and I may struggle to identify a single one. I've said this publicly in a number of different settings. I think the most critical aspect with these really complex challenges is that we hold together as a community, right? There are lots of different perspectives. There's a lot of stress on our organizations, on our families, on our students. And in that moment of stress, oftentimes people can get torn apart instead of pulled together. And for me, one of the critical challenges is to ensure that we stay together. So I would offer that as a thought. In terms of masks and dress code, what we are more focused on with masks is that they are approved by our nurses and meet standards. There are some masks that are not as effective as others, and we are trying to get good information out to families so that they will know which types of masks are most effective in preventing the COVID spread, and to let them know if there are certain types of face coverings that would not be considered acceptable because they don't do the work that they need to do in terms of containing the virus. So that is what I would offer in terms of that. And again, Mary Beth Ting, if there's anything you want to add to that, I would appreciate any comments.
Can I add something real quickly about that? There was a question to school committees this week, things about can a student have a Donald Trump mask? Can a student have a Go With Joe mask? Can a student have a Black Lives Matters mask? And that's where that really does intersect with our dress code. Like, you can't have a marijuana leaf on your mask because that's not allowed under our regular dress code for your regular dress. So we would certainly enforce those types of things, but I don't think we're going to get into political statements because we would allow political statements on your clothing.
Yeah, maybe just a quick frame of reference. If it's okay on a t-shirt, it's okay on a mask.
Thank you. Mary Beth, a question, this was obviously sent to us before today, but it said, when will parents be able to actually see the plans to make an informed decision? If that's what, it seems that with less than 2 weeks until the start of the school year, there are still a lot of promises that are TBDs in planning, let alone implementation. So I think in spinning that to today's, what happened today, how can parents plan when something like this is so fluid and change? Do you have any advice?
And one of the things I think that it's important for the community to know is that we are mindful and sitting with the consequences we know this has for many families, that they were struggling enough trying to figure out how to do the hybrid, and then to have those days back out is equally challenging. What we had in place to go out at the beginning of next week were what schedules look like for the in-person time and for the remote time. We will still be getting those out, although that will not be the priority next week, given the change in venue, so that people will know how the learning experiences will be split up. I'll give some general comments. So the general structure of things is in the plans. I know folks are looking for additional details. And the details vary by level, from the high school to the middle school to the elementary school. All administration at those levels were prepared to send, again, more details at their level out at the beginning of next week. And so again, what we'll now shift to is to make sure that people understand what will look like during the time that we're in remote before we transition back into hybrid. And we'll need to, that will probably push things out probably to Tuesday or Wednesday, where we can give more detailed plans. We'll need to pull teachers together to offer thoughts around, again, the full remote start, as we had been primarily focused on a hybrid start. A couple of other thoughts that I would offer around instruction in this time is that good instruction never is teachers delivering direct instruction to students all the time. Best practice means that there are some elements of direct instruction. There are elements of independent practice, collaborative work, applying the learning concepts to an authentic situation, and some level of reflection. So all of our programs under an umbrella are incorporating all of those elements. And what our teachers have been working on are what are the pieces that need to be in person, or in a case of a remote situation, synchronous, and then what are the pieces where the students can be working in a virtual environment without direct contact with a teacher. So what we will be working on next week is to look at those pieces of instruction that were identified as being in person and transitioning them over to synchronous learning during the time that we're in a remote setting. So families will get more detail. This threw a little bit of a wrench in terms of our timing, so I think we're probably looking more about midweek next week. And again, we appreciate people's patience as things evolve. The last thing that I'll say is that in terms of schedule, in a normal time, if you went from classroom to classroom, schedules vary from teacher to teacher. That's a reality. So it's difficult to put any one thing out that would tell a parent this is exactly what your child's schedule is going to look like, because there will be some variation from teacher to teacher and subject to subject.
Thank you. I'm going to, staying with you, a question from Lindsay Seward. Our daughter will be entering third grade this year. Can you please detail what the school day would look like for her? How many hours will she be in class? And will she still be in the same cohort?
And the remote model, is that what the question is asking?
Well, it's maybe both. How about when there is school, what can she expect? Because I think that
in our hybrid model that we haven't.
That was my question in the remote. Thank you.
Okay, remote.
Yeah. So what we are looking at in the remote, and again, I want to give room to have plans evolve next week. Again, this information was finalized this afternoon. But in a remote, in the hybrid model, there are 2 days that are in person and 3 days of remote learning. What you will see now, those 2 days of in-person learning will include synchronous work with teachers. In this modality, we may spread out some of that synchronous work instead of focusing them on just 2 days. We need some time to talk to our teachers about that. But it is transitioning what was in person to a synchronous type of instruction in a remote environment.
Thank you. I'm going to go back to Board of Health, if somebody can answer this question. Positive test results reported to the state based on each positive test. If one person gets 3 tests and each of those tests are positives, does that count as 3 positive tests reported to the state, and it's only related to one person? Mayor Beth.
I'm happy to take that. So I can speak to how that works. When a person has a test positive or negative, it shows up in our MAVEN software. MAVEN's an acronym, the Massachusetts Virtual Epidemiologic Network. We've been using it for well over 25 years for all sorts of reportable infectious disease, whether it's tick-borne disease or influenza. All kinds of things are reported through that, and we're using it a lot, obviously, with COVID. So for each time there's a lab value, it generates an event in our MAVEN system. And most of the time we're not seeing the negative results. We're alerted when there's a positive result for any sort of disease. So there have been individuals with whom I've worked who have had a negative, positive, or positive, negative. So all of the labs are appended to the same person. The only thing I will say that I have not seen yet that may be ahead of us in the pandemic, which I hope doesn't happen, is if we have somebody fully recover. And the state and CDC guidance right now is we're expecting that people who have recovered from infection will have immunity for up to 90 days. And the guidance to local Board of Health and public health officials currently is if there are symptoms or re-exposure after 90 days, that person be retested. If after 90 days there was a new positive test, that would be considered a new number. So that would be, if it were myself, there would be my first infection and then my second infection. That hasn't come up quite yet, and I hope that it doesn't, but that would be one way where the same person would be counted twice. But if we're seeing the tests going sequentially in time, we know that that's the same test result. And part of that reason is within that 90-day window, the test might still be detecting virus, not live virus necessarily, not virus that's capable of causing infection, but detecting the DNA of the virus. I hope that answers the question.
All right, I'm going to shoot back to the issue.
Could I
of-
just add, I'm sorry, Anthony.
Oh, sure. Sorry, Christine, go ahead.
That's okay. So if you retest within that 90 days, you may have a negative, you may have a positive, but you're non-contagious. So if you see people that need to move through different facilities, institutions, before they're admitted, they need to test again. And that wasn't an issue that we had as far as someone testing positive a second and third time, because intermittently there had been negatives. If it's within the 90 days, it's the same infection and the person does not need to re-isolate, nor would they be able to infect another individual. Just wanted to make that point clear. You did a great job, Mary Beth. Thank you.
Great point. Thanks, Chris. So Massachusetts has the Masked Up campaign. So I think it'd be important to talk about masks as kids eventually will get back into schools. So what should be their approach on masks and what kinds are the best?
So can we start? Yeah, somebody on the Board of Health can talk about what's best, but we would just like everyone to know that our policy is going to be that everyone wears a mask. So if you are 3, you're wearing a mask. If you're 33, you're wearing a mask. If you're 103 and you come into the building, you're wearing a mask.
So the question of, that has come out a lot recently is about, masks, face coverings, and the type of material and how does that affect the possibility of allowing for respiratory particles to dissipate from the from the face covering. And so there, everyone has been looking recently at this study that came out of Duke, looking just at the material itself. And they looked at several different kinds of face coverings and surgical masks and N95s and gaiters and bandanas and such. And, again, it was a good study in the sense that it gave us some initial look at how potentially we could measure material when it comes to respiratory particles. But again, I think it just sort of gave us the initial look at what we should be doing. If you look at the World Health Organization and the CDC,
Dr. Ting, if I may, we have some CDC graphics queued up that talk about face coverings that are good to use and face coverings that you might want to avoid. So if I could just ask Anthony to pull those up, they're very helpful graphics. And we will certainly work with both town halls to make sure that these graphics and the school district is able to make these available to families. So as you can see, the fit is one of the most important things. It needs to firmly fit, covering the mouth and nose and going down underneath the chin so that there are no holes on the side for any air to leak around. Ideally, have 2 or more layers of washable, breathable fabric. And Anthony, if you could, and on the right-hand side, it's showing you things that are less good to use. Like for instance, the middle one there shows a valve. And sometimes you will see people in stores and things wearing one with a valve. What that allows is the valve will open upon exhalation, and then it's really not doing the purpose that it's intended for. And then Anthony, if you could switch to the next one.
Oh, same one.
Yes, it is. Thank you.
So I was getting back to my point was that face coverings taken out of the full sort of now the trio of mitigation strategies is hard to do because again, it's the combination of a face covering which covers your nose and mouth, a minimum of 6 feet of distance, and frequent hand washing and hand disinfectant that really is going to do the job. Where if you take one without the other. So, my personal choice is that, as long as if it covers your nose fully and your mouth, and the only other thing I would say is if the fabric doesn't allow, like, for example, light to come through it, it's completely opaque or blocking of light, it probably will do the job. But again, taking it out of context of not doing the distancing and frequent hand washing or disinfectant, in itself, you got to do all 3 things. So my hope is that, everyone will do those 3 things.
And I would say that I know that the Hamilton Wenham Regional School District nurses are working very hard on providing education to families about and students about how to handle the masks, how to get them to fit properly, some little hacks you can do if there are difficulties in getting a proper fit. This graphic here, I know that gaiters have been a big cause of discussion since the Duke study came out, and the CDC is recommending that evaluation is ongoing. We don't have a lot of evidence to say that, they're should never be used, but we don't have anything indicating their effectiveness. So in an abundance of caution, I believe the schools are leaning toward advising against the use of gaiters at this time. Similarly, bandanas don't have a tight fit underneath the chin. So that's there as well. Face shields are not considered a replacement for the face covering. They can be used in coordination with a face covering, but they are not a replacement for. Thank you, Anthony. You can take those down.
Thanks.
If I may just interject, Anthony, just to provide a little comfort, the district has secured the DESE recommended purchasing of PPE. So we will have the 3-ply disposable surgical masks available for when people do return, for staff and students, for some of our employees that require enhanced PPE, such as KN95s and face shields. Those have been secured, gowns, and we even have the child size disposable masks for some of our younger kids in case they have a mask mishap during the school day once we return. So.
Okay. Let's can we go over the flu vaccine clinics? Let our residents know when they will be starting and how that's going to play out.
Can we talk about the Hamilton Wenham schools being closed and Gordon being open despite their positive tests? I'm sorry for speaking out, but we're getting on.
Okay, as I said earlier, if somebody speaks out, we're going to just put them into the waiting room. We're trying to address the questions. There's a lot of questions tonight. We have a lot that was pre-submitted. Our panelists are trying to go as over much detailed information as possible. I know that we probably, and we're not going to get through all these questions. I'm happy to host another one of these forums again. I'm sure that if you can reach out to any one of the panelists too to get your questions answered. Just going to ask everybody stay patient. We're back down on 8 minutes left. So I want our residents to know about our flu clinics. Then I'm going to ask our panelists to give some closing remarks about a couple minutes. And then our session ends for tonight at 8:30. So who wants to take flu vaccinations? Thank you, Chris.
So for the town of Hamilton, we have not yet received our flu allotment, so we do not have any in-house. We're utilizing the AFC urgent care facility on Dodge Street in Beverly. And the first round of our drive-through clinic will be held for our essential workers, which are our teachers, our EMS, and our Hamilton town staff. With having no vaccine on site to vaccinate children, which would be our state vaccine, or our seniors would be our high dose. AFC has graciously offered to help us in conjunction with the Hamilton Fire Department to host that drive-through again for teachers, staff, Hamilton town employees. Thank you.
And Wenham is planning our first flu clinic on October the 14th with more details to follow.
Great, thank you.
Can I just add one thing there? So
Sure.
as we know, the Massachusetts Department of Public Health is requiring all students to get all students registered in a public, actually in any school, to get a flu vaccine by December 31st of this year. So I would highly recommend that people be in touch with their pediatricians as quickly as possible. That applies to students who would be in person and those students who would be remote. And it applies to college students as well. So.
Thank you. I want to thank all our panelists tonight. I know that there's something in going through this pandemic, we're trying to do the best we can. We don't have all the answers, and sometimes we don't even have all the guidance from the state level. And we're truly working as hard as we possibly can, be putting in many, many hours beyond the workday to try to do the best that we can for our residents. There's no textbook on governing or being a superintendent or even being an elected official during a pandemic. We appreciate everybody's patience. And with that, I just want to thank you all. And I'm going to go into final and closing comments from our panelists. And I'm going to start with Dean Holliday from Gordon Conwell.
Happy to be part of this, and yeah, however we can help, we're happy to do that. So, thanks.
Thank you, Dean. Rick and Gordon College and Chris, thank you. And
thank you, Anthony. I appreciate it. I would probably just add, I know reading the chat as we've gone along, I certainly understand the frustration of parents if you're looking at metric numbers that are barely crossing a threshold, and that's dictating decisions that the school board feels they need to make. And again, as they noted earlier, a lot of this is judgment calls. I know from our standpoint, with the testing that we did to get the semester going, those numbers are a point in time. This time next week, those numbers could look very different, could be much lower. So all I can say in terms of Gordon and our desire to be very vigilant in both running our campus, but also being a good neighbor within Wenham, I can tell you absolutely that the school has been committed to being vigorous in how we're managing this. And, you're talking about single numbers in a very, large denominator. So you got a 0.33 positivity rate. That actually looks very good to us. But I understand the way the numbers play out in the system, the way the state has set us up, that can make it a lot more challenging. So certainly, kind of feel the angst and the disappointment that a number of parents have been sharing tonight. We understand that.
Thanks, Ray. David in Hamilton.
Thanks, Anthony. I have been following the comments here, and I appreciate that there's been a lot of concern expressed about how is it that a couple of positive cases at Gordon College can have the effect that they have on the Hamilton Wenham Regional School District. And I honestly feel we probably ought to go back and revisit how we calculated the numbers, and in particular, look at Gordon College and Gordon Conwell Theological Seminary both. And if the management at Gordon College can help us understand to what extent the student body and perhaps as well the staff can be effectively quarantined on campus, I think that's an important matter that we weren't able to account for at the beginning of this effort. And remember, I'm going to go back to where I started. At the very beginning, I said, we don't know everything about this virus. What we do know is constantly being updated, changed. We find new things every day. If we all knew today if we all knew back in February what we know today, we'd be in a lot better shape.
Yeah.
Hindsight's great. So what I'd like to do after this meeting tonight is go back and ask the question of our boards of health and Gordon College and Gordon Conwell Seminary, ask if there are ways and means to help in some way isolate the positive cases that have and maybe will in future occur at these congregate living facilities that are very different from how the students and staff at the school district facilities work, and see if there's some way we can account differently for what we've done. So that's I can commit to everybody. We'll revisit that question.
That's great.
Tough one.
I think that
I don't know all the answers.
I think people
we'll
would
revisit
appreciate
it.
I think people would appreciate that. Thank you, Dr. Perez or Chris Lee. Dr. Perez, I see a hand.
Yeah, so I wanted to address these other pieces that I think has been brought up generally, which is the emotional well-being of our students. And that is something that is of the utmost importance to me as a researcher and as a psychologist. And I think one thing to consider here is that there are many factors that increase someone's mental health risk. So stress, anxiety, lack of peer contact, but also mental illness, domestic violence, child maltreatment. So there's so many other things. And I think to link solely the opening or the closing of schools to increased mental health risk really denies the role of so many other factors. And one of those being the fact that we are in the midst of a pandemic, and that uncertainty that parents are struggling with are things that our own children are also sensing. So that cause and effect relationship is not something that we're able to answer with the research alone. What we really are seeing is this observation. So it's something to keep in mind that just simply opening or closing the schools is not alone going to impact our children's mental health of so many other factors. And as parents, this issue of trying to find ways to offer some consistency is in whatever means we can is something that's going to be critical. And I think the other piece I also want to add here, especially in trying to figure out what's going to happen with this hybrid and remote pattern as things continue to progress. When we are trying to compare learning environments, right? We're using traditional learning environments, traditional schooling, and comparing that to remote learning. And an important factor to take into consideration that this is a different time. So even in the learning environment during this hybrid phase, there are so many other factors that are going to impact and interfere with learning in a way that maybe we are unable to measure. So just to keep that into account. So I just wanted to put that out there, and I know that we have not had the opportunity to address many other questions that people have, and it's not for lack of want, but certainly for just lack of time. But thank you all for listening.
Thanks, Dr. Perez. Those are great points. Dr. Ting and the Wenham Board of Health, followed up by the Regional School District.
Yeah, so part of it, when we put out the document that we did, we had a sort of an introduction and preface that this is for us. There's no historical data in which we can decide how we choose what we choose, and that everything is moving very quickly, and that our approach was that we need to constantly evolve what we're doing as the data comes to effect. And so obviously, some numbers occurred that we did not expect. And so, as David said, both boards will be re-looking at things and Again, we're trying to provide as best guidance as we can to the school committee and the superintendent. No matter how you cut the line, some people are going to be happy, some people are not going to be happy. But the boards of health have to balance that versus the public health and safety. And so, that's one of our main objectives in doing this. So we tried to take in consideration both that and the educational needs of children. And so, we will continue to meet. We meet almost on a weekly, bi-weekly basis now to review things as both individual boards and as joint boards. So we'll continue to work and do the best we can do.
Thank you, Dr. Tang. I know Joe and I both very much appreciate the work that both boards of health have done and the guidance that you've given us in helping lead through this pandemic. Gonna go finish off and round out with the schools. Mary Beth.
Thank you. So I'd like to echo a lot of the thoughts that I've just heard, that our first priority is for the safety of our students, our teachers, and our community. So that will always be the driving force in terms of decision making. And I again want to express appreciation for the thought and care that the boards of health have put into providing us with metrics. And I think, like so many things, we may see different iterations as learning occurs and evolves. And I know as we move forward with our instructional programs as well, I have no doubt that there will be numerous iterations as we get smarter when we start to implement things that we have never implemented before. So I wanted to just frame that for folks and to think about that. I also know that there's I saw some comments in the chat and some worries about we really want to know what these schedules are, and we should know what these schedules are. And I want to let folks know that this week the teachers were focused on building out the virtual component of their programs, which in a hybrid model would be 3 days, and when we're in this remote time would be for all 5 days. But that was a focus of all of our teachers across the district this past week. As a reminder of the time frame that we're working with, our plan was voted on August 14th. And so we did not have clear direction as to what the plans would be until we knew that that was a voted piece. And our teachers have been working diligently to put forth more concrete details around that. And again, we will be able to send out some exemplars next week of what online learning and the virtual environment will look like. And we will be able to get people information about how during this remote time, we will shift the in-person learning into a synchronous environment in the remote model. So stay tuned. I know this is frustrating for families. I know people are looking for answers, and I want to assure our community we are working as hard as we can to get them to you as soon as possible, and we remain committed to ensuring students, faculty, and the community is safe, and that we are providing our students with a high quality education, even in these unprecedented times. Thank you.
Thanks. Michelle?
I would, all I can really say is just, we need to keep in mind, as parents, we'll do anything to get for our children what we think is best for them. And we all really understand that emotion. Most of the people on this panel here are parents themselves. Most of us have children in the school system, and I'm sure were part of some difficult decision making, even though you knew it was going to affect your own children. So we want to remember that throughout this, what we need to do is support and encourage people to express themselves in ways that are positive and are not demeaning to the people who are their neighbors, who are their servants, and who are leading through service. And we really encourage ideas and feedback, but bashing and negativity, as Chris brought up at the beginning, is not getting us to a place where we can actually be a community that's doing the best for our children. So we'll, I'm sure, have one of these forums again, and I think it would be great. I want to say that, Anthony, you did a great job because you gathered questions in advance and did a great job of going through those. So we really appreciate your moderating tonight.
Oh, thank you. And thank you to all the panelists, and thank you to all our residents. On behalf of Joe and I, we stay safe and have the best school year that you possibly can have. Thank you, everybody. And